Dzień dobry, witam wszystkich bardzo serdecznie. Cieszę się, że dołączyliście do nas na dzisiejszym spotkaniu z Mają Suzuki. Pierwsze spotkanie robimy w formie wcześniej nagrywanej, tak żebyśmy mogli dołożyć polskie napisy i żeby wszyscy mogli w jak najlepszy sposób zaznajomić się z tym, kim w ogóle jest Maja Suzuki, jaką drogę przebyła i jak wygląda krzewienie tradycyjnej japońskiej medycyny w Polsce. W kolejnych spotkaniach o tym będziemy dalej rozmawiać. Będziemy się spotykać już na żywo i zamysł jest taki, że nie będzie więcej tłumaczeń na język polski, więc prosiłbym o wyrozumiałość i zapoznanie się z dzisiejszym wywiadem. Serdecznie zapraszam. Yeah, okay. Hi, Maya. So nice to
Hey,
have you finally here in this format.
yeah.
We've been following each other for quite some time now.
hmm
And I think it's perfect moment to introduce you to Polish practitioners.
Yeah.
So starting from the top, can you introduce yourself a little? Maybe give us a short version of your origin story, how it all started with you, with
Yeah,
the Japanese
sure.
acupuncture.
Yeah, well, first of all, thank you so much for inviting me on to do this. I am really excited to come out to Poland next year, to meet everybody and to see all the great work that you've been doing in spreading traditional Japanese medicine. So thank you. But yeah, I'll give you the short version. So I wanted to be an acupuncturist since I was really young, and that all started because I was born cross-eyed, so I was born without binocular vision. So I don't know if
Okay.
you're familiar, one eye works, the other eye kind of doesn't work, and then it starts to wander around. And so
Okay.
I had probably 12 or 15 cosmetic surgeries as a kid to try to fix that, and nothing fixed it. And I had a lot of classes and things like that. And probably because of that, I had extremely horrible headaches, like really bad migraines as a child. And it was the only time that my mom didn't give me medicine to try to get rid of them. She actually did acupressure on Gokoku, so Li4 here,
Oh.
because she had a little acupressure book that she just had, and it hurt so much, but it always helped the pain go away. It helped the headache to go away. And I became obsessed with that book, and I stole my mom's book, and she wasn't using it, so it's kind of okay. But I stole her book, and to this day, I haven't actually read the book. I've only ever looked at the pictures. And I would do acupressure massage on everybody who I could meet, and I tried to guess what was wrong with them. Like I was a weird kid anyway, but eventually my dad who drove a bus, the local acupuncture school here in Denver, Denver, Colorado in the US, the acupuncture clinic director rode my dad's bus, and my dad told him about me, and the director was like, "Hey, yeah, you should come in and try acupuncture out." And so I did, and it was fantastic. Like it blew my mind. I was like, "Screw acupressure and massage. I want to be an acupuncturist." And that was when I was about 15, 16 years old. Um, and then my good mom was like, "Why don't you go get a real degree and then you can do acupuncture?" So I did, and I went to school for Japanese and then went and lived in Japan and all of that, and eventually decided that I really wanted to become an acupuncturist. It's kind of a long story of why, but um,
Yeah.
I ended up being an assistant in an acupuncture clinic in Tokyo, Japan for about a year. And I
Okay.
worked for free 40 hours a week. Like literally, I told the director, Taikenjo, I was like, I will clean your toilets for free if you just let me watch. And he
Wow.
did. Yeah, I owe him so much for my career. Yeah, and so I worked my way up through the clinic. Eventually, I had a paid position. Eventually, I was able to do moxa and, talk to the clients and run the front desk. Like Dr. Joe really gave me my start in this medicine. I owe him so much. Um, and then the other assistants helped me get into acupuncture school over there. So I got into acupuncture school and I went to acupuncture school in Japan for 3 years, which is the
Mhm.
standard education. And then I took
Yeah.
my national exam there. And so I'm licensed in Japan,
In Japan.
um, worked in Japan, along the way met my teachers of Yashinomichi style, and then came back to the US in 2015. And then I re-got my license back here in the US, which was a whole big pain in the butt. So yeah, now I'm licensed in the US through NCCUM and then also in Tokyo, well, in Japan.
Wow,
Yeah.
that's amazing.
Yeah.
So, could you shortly tell how you succeeded in studying in Japan? Because from my position, it looks like landing on the moon. So complicated.
Yeah, I
How,
mean, I have a whole video about like how to study and learn in Japan, but like really the biggest thing is that you have to know Japanese. Like you have to.
yeah.
And if you don't know Japanese, there's just no place for you to get educated, really. Like you could find a teacher maybe who's willing to like stick it out with you, but you're not going to really get the full education. And then the other really difficult piece is that you either have to have a lot of money saved up, about 60,000 US saved up, or you have to somehow be able to get a loan in your home country, or you have to be married to a Japanese citizen to get some type of like educational loan. Because as a foreigner in Japan, you're not actually eligible for educational loans, at least at the time
Mhm.
that I studied. So there's a lot of different barriers. One, money is a huge one. And then I think
Mhm.
secondary is that you have to be able to not just be conversational in Japanese, but you have to be able to, learn medical Japanese.
Learn medical stuff in Japanese, so
Yeah,
pretty
yeah,
complicated. Yeah,
yeah.
I
So
know, I know.
it'd be like me trying to go to Poland and learn acupuncture in Polish. Like I would be lost.
I get you.
You
Yeah, I
know?
get you. That's exactly my story because, I found a teacher who is teaching me, translating Japanese into English. We're trying to communicate this way. It's going okay, but for now, I'm pretty aware that I cannot go any further without knowing Japanese. So
Yeah.
that's why I'm trying to catch up to learn. So in few years, I can proceed and still level up because for now I'm like reaching the wall
Mhm.
for books, for teachers,
Yeah.
plenty of knowledge which we cannot access because there is language barrier.
100%. I mean, one of the reasons why I started ShinKyu University, my mentorship program, is because that I'm trying to give that kind of education, that foundational education to people in English, right? And so one of the things I'm doing in ShinKyu is translating books. Like I'm translating my teacher's copy of the Shanghanlun and another copy of a different Japanese classic, and trying to be that gateway. But I find that for a lot of Japanese practitioners, I'm sure there's one or two of them that are around that are good enough at English and willing to teach foreigners.
Mhm.
But
Yeah,
for most of them, they're like, I don't have good enough English. And it's a
yeah,
lot of time, right? Like that they don't get compensated for. And yeah, so that's kind of my goal with ShinKyu is to be that bridge for people. But I agree with you that at a certain point, without knowing Japanese, it's really difficult to really get to what they call the okuden or the advanced upper level learnings. It's very, very
yeah.
difficult.
Mhm. Yeah. So we understand each other pretty good.
Mhm. Yeah, I mean, I think the other piece too, I'm sure you understand this, Oscar, is that if you don't live in Japan, right, then you're not
Mm,
able to constantly see your teacher's hands and how they
yeah.
practice, how they needle and all of that. And there's only so much you can get from like a 2-week workshop or a weekend workshop.
Mm,
And again, that's the other reason why I started ShinKyu is so I could at least digitally start to see my students every week.
mm.
And then
It's better
after
than
that,
nothing. Yeah.
yeah, and then after that, be able to see them a few times a year in person, right? Like to
Mm.
find this in between. Yeah.
Sure. And also there is the other side of the story because Japanese are pretty closed. And for example, right now they are starting to notice that they missed their opportunity to show off to the world like TCM practitioners did.
Yeah.
That's why TJM is not so known in the world. And for example, my teacher who has joined ShinKyu Society Committee. He asked them why there are no books translated to English, and they were shocked, like, "Oh, should we do this?" So even Japanese practitioners don't think in this international manner.
Yeah. Well, I mean, just to follow on that. So I've done translation at WAFAS, so the World Federation Acupuncture Summit, maybe. I don't know what it stands for. And so they are doing translations, starting to do it, but like even with my group Iyashinomichi, and I owe everything to my group Iyashinomichi. Like I love my style, and I try every time I do a workshop in Japan, which I'm doing another one in November of next year. Every single time I have like a special workshop for Iyashinomichi style, like I'm really trying to spread it. And I have already between 10 to 20 people who would love to join the Yashinomichi group and start to really grow within the group. And I talked to the leader of Yashinomichi, and what he told me was, look, until we have someone who's at teacher level, which I'm not yet, I'm at the middle practitioner level.
Okay.
Until we have someone at teacher level who can speak English, we're not letting anybody in who speaks English as their base language. They have to speak Japanese. And then he
Okay.
also said we need to have all of our main textbooks translated into English. So there's a lot of, um, I understand the reasoning for that. They're like, we don't want to bring someone in and not be able to support them in their learning. That's not fair to
Yeah.
the practitioner. But I think to your point, Oscar, like it's there's such an opportunity to help so many practitioners worldwide with TJM to really excel their practice, to really give them, in my very egotistical vantage point, what is more true to the classical medicine, right? To give them that in their hands. And we're kind of missing a really important window, I feel, and on to double that, a lot of the people who have really been huge proponents of traditional Japanese medicine, like Stephen Brown and Jeffrey Dan, and all of these people, Bob Quinn, and there's a few people, one or two people in Europe, they're all getting really, really old, unfortunately. They're in their 70s or 80s. And so it's
Stephen Bird,
really
for
up.
example.
Yeah, even Kiko Sensei, right, is getting quite
Yeah.
old. I don't think
Yep.
she's going to ever stop. That woman is powerhouse, though. She's amazing. But like it's really going to come down to people like you and me to even continue the spread of it because
Yeah,
it's
I'm aware of this. Yeah.
yeah, yeah. Anyway.
Okay, so talking about Yashinomichi, yes, this is correct, the name of
Mhm,
your style.
mhm.
Can you give us few characteristics of the style?
Yeah, so Yashinomichi is different, just to say from the start, very different from Japanese meridian therapy, which I think is what most people understand as
Keiraku
like,
Studio.
yeah, Keidaku Chiryo is like the basic. They're like, oh, traditional Japanese medicine is Keidaku or is
Yeah.
Toyohari, right? And
Mm.
actually, Toyohari is an offshoot. It's a branch of Keidaku or Japanese meridian therapy. My style, Iyashinomichi, has nothing to do with Japanese meridian
Mm.
therapy. So Japanese meridian therapy is going to pull very much from um, the 69 chapter of the Neijing, I believe, and or Nangyo, the Nang. Anyway, 69 chapter. It's not the Neijing, the other one. But my
Nanjing.
style, huh?
Nanjing?
Nanjing, thank you. My brain wasn't getting there. My style actually pulls a lot more from the Shanghanlun. So it does have its
Shanron.
yeah, it has its foundations in the Yellow Emperor and the Neijing and the Nanjing and all of these other classics. And we're definitely pulling from that and understanding the meridians and the points that way. Um,
Okay.
And we're also pulling in this huge other piece of the Shanghanlun and saying, how can we use herbal medicines to help support our acupuncture and moxa? Because there's a lot of knowledge of understanding the body from a 3D image in the
Mm.
Shanghanlun that doesn't
Mm.
exist in other texts, right? And so we can have a huge, if we can expand our volume to include herbal diagnosis, not so much for the herbs, but more so for the acupuncture, then we can become better practitioners. So that's I think the biggest difference. We also pull on different classics in Japan as well and do it's a very Zen oriented minimalistic style. So um, we only use one needle for the whole treatment. So we'll place the
Mhm.
needle, we'll allow the key to arrive at that point, and then we
Mhm.
remove the needle and go on to the next point. So we
Yeah.
don't ever retain needles in the body. I think is also a huge characteristic
Okay.
difference from Kirachu. Yeah. It's
Sounds very
different.
nice.
Yeah.
Although it sounds pretty similar to what my sensei taught me, but
Yeah.
his style is a medley of different styles. You know, like he's mixing. He's not really. He's not stick to any in particular. So maybe these what you have said is are some things that he took from your style, maybe something I don't know. But his wife
Perhaps.
is performing campo medicine, and they are also combining those two. So
Okay.
it sounds similar, yeah.
Yeah. Well,
You are using it in the yeah.
there's not a lot of
Yeah.
styles in Japan that use kampo simply because in Japan, to be able to dispense herbs, you have to be a pharmacist or a doctor,
Yeah.
which is a whole history lesson. But essentially, the US, as we do, um, twice now has forced their country to not be able to use herbal medicines unless they're a pharmacist or a doctor. So we did it once
Oh.
during the Meiji Revolution, and then we did it a second time after World War II. And so the
Mhm.
reason why acupuncturists in Japan can't use herbs are my people's fault. It's all my people's fault. Unfortunately. Um, yeah, I mean, he could possibly be pulling from our text, the group's text. I don't know. Not a lot of people in Japan who are acupuncturists or herbalists, though, for sure. And I would also add, though, like Iyashinomichi is not a big group. Like we're quite minor as far as styles are concerned in Japan.
Yeah.
So it's possible. And
Okay.
I don't know. Yeah, it's possible.
Okay, I'll ask him later
Yeah,
about that.
yeah.
Talking about US standards and Japanese standards, can you tell something about how you felt when you came back from Japan and tried to perform Japanese acupuncture in US, and what was the problems back then?
Yeah. I think the biggest one, number one problem was definitely lack of community.
Mm,
Number one, I don't know how it is in Poland, but here in the US, practitioners are very afraid of other practitioners stealing their clients.
mm.
I don't know if it's the same there, but
The same,
is
yeah.
it? Yeah, like in Japan, I don't personally, I don't think I've ever personally felt that because, and I think honestly in Japan, I think it has to do with the licensure. So in Japan, once you're licensed for life. So I've never had to do continuing ed or anything like that to keep up my license there for acupuncture or for moxibustion. However, I've done thousands of hours of continuing education. Like I'm literally translating my teacher's book. Like it's here
Mm,
next to me, as part of my continuing education. And so I think it's, in Japan, it just goes without saying that, of course, you're going to join a group of other acupuncturists. Of course, you're going to read and continue your practice. Whereas here in the US, you have to take classes to continue your education. And so people take these like one-off classes or 1 hour webinars, or, it's like
yeah.
this 2 day class, and all of a sudden they're a master of tongue style, or, they take a 2 day class over here and, they've graduated to this level. I've talked to so many of those practitioners and they're like, I don't feel like I've learned anything from these classes, or, I have more questions that I came away with and answers, and so I think that's the number one problem is just having a
Mhm.
community that's supportive and continuous, like the mentor, like my group, Yashinomichi. I
Yeah.
go to my group in Japan once a month. I could go to my group there if I lived there 5 times a month to study with different like groups within the main group. And here in the US, unless I put on a workshop, there's not a lot of people for me to talk to. I don't have
Mm.
anybody to talk to about my patients. I don't have a mentor here. I have one in Japan. Um, I would say the second biggest thing that I ran into is really, I mean, a different standard for the medicine. I mean, as far as the patients are concerned, the patients don't care. I mean, I think you'll agree with me, right, Oscar? Like, if it
Yeah.
works, the patients will come back, right?
Yeah, yeah, I love that saying that patients don't care what you know, but they want to know that you care.
Exactly. Exactly. And I think it's important. Like, if your practice works, you're going to get your patients back in. Um, But I think from the practitioner side of things, I think in the US especially, it's just so, well, not even the US, the rest of the world, it's so theory-based, the medicine, and so
Mm.
little hands-on that
Yeah.
people kind of didn't understand what I was doing at all. At all. And an
Yeah,
example of
yeah,
this is I had to go to the student clinic to get my license back. I had to go back to school for 2 semesters here.
yeah. Hmm.
And I was in the student clinic for most of that time because I had 10 years of experience and I needed more clinical observation hours. Meaning I needed someone else to observe me, which was whatever. And I was obviously pretty popular and it was funny because I would be treating a patient with neuropathy in their feet and I'd be like, "All right, well we're going to do bloodletting and moxibustion and this and that." And like the observing teachers would be like, "Really? So that's interesting and it worked. Oh, how cool." Like so,
Yeah,
but
yeah.
it's not because I was telling a friend yesterday, it's not because I'm special. It's not because I do something unique. It's because I'm normal in Japan. Like the normal level
Yeah,
of practitioner in
yeah,
Japan
yeah,
is
yeah.
so much higher technically
Mm.
than the normal level practitioner anywhere else because there is a difference between being theory based and
Hmm.
technique based. I
Yeah.
mean, and yeah, that doesn't mean they're better or worse. It just means that they can do different things.
Yes, 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 yes. I think we cannot say how much important this is because this is the biggest issue about Japanese acupuncture. We should shout out to people about this because, frankly, what acupuncture misses today the most is practical skills.
100%.
So
Which is
there's
insane.
lack of, yeah.
It's insane. Like you would think that would be the thing we need the most, but yeah. I mean, and I think that's what you're doing from what I've understood from your classes as well, Oscar, is like you're trying to give people this technique or to start at least giving them the technique,
Yeah,
right?
yeah, yeah. Just taste of what it is.
Which I love. I love that,
Mm.
and you know, uh, so I teach at the local acupuncture school here in Colorado called CCMU. And I teach their moxa classes and like a Hara diagnosis class and a Shonishin class. For those who are watching, Shonishin is Japanese pediatric acupuncture. And to be quite honest, like my students here, they'll get 12 hours of moxa instruction between the 3 classes that I teach. That is more moxa instruction than any other school in the US that I know of.
Mm.
12, just 12 hours. They get 12 hours. When I went to school in Japan, we practiced our moxibustion every single day for at least an hour, 5 days a week for 3 years.
For 3 years. Yeah, yeah.
It's insane. Like the is yeah. Anyway, yeah.
So
So
this is how it should be done.
yeah, in my opinion, like the educational model that we have right now is really failing our practitioners, and then they
Mm.
go into practice. And it's like, I don't know if you have that expression, a deer in the headlights, when there's a deer in the road and you're about to hit them and they stop and their eyes are really big. And that's how so many practitioners have told me that they feel because they get into practice and they're like, I have no idea what to do right now. Like, And that's something that their education should have prepared them for, and it didn't. So, anyway, I would say
Yes,
those are the
yes,
top two.
I understand you very well. For example, when I show my students that they can grab a hand or head and check the range of motion to check the status of the channels and to
Yeah.
choose which side to needle, they are, oh, really? Are we allowed to do that? First time I see this, so this is the
Yes.
level, you know?
Yeah. Yes. Yes, you are allowed, and please do it. I think it's just, yeah, I mean, I think that's the biggest thing that I really ran into besides this lack of community on a personal level. Like I learn better when I have a group of humans learning with me and a group of humans supporting me, both better than me and like, well, I should say above me in learning and below me in learning.
Yeah.
Like I need both in order to
Mm,
become a better practitioner. And it just does not exist. It doesn't
mm,
exist. And it's really hard to create as well, you know? So I would say on a personal level, the lack of community and on like a professional level that's affecting my peers, how I learned, how I practice, the education I need to do and all of that. It's definitely the lack of hands-on ability.
mm.
Yeah.
Yeah, it's difficult to build such a society when there are so many people who are afraid to show, to share,
Yes.
to join just and work together. Yeah,
Yeah.
yeah.
I
The
think
same with the, mm.
I mean, I don't know. Is it the same in Poland where most people are self-employed, that they run their own acupuncture clinic? They don't work for
Uh,
someone?
Mostly, yeah, yeah,
Yeah.
yeah.
So I think that's also another piece that needs to be mentioned too, is that um, even in Japan, honestly, and in the US, there's not enough business education that happens for these practitioners. And so when they get into self-employment, right? They're so busy trying to take care of their clients and just keep their head above water financially and keep their business running that they actually, sometimes I just don't think they have time for community either. I think that's
Mm,
important to also say.
mm,
Yeah. So,
yeah. And this is financial education is not about being too greedy or something like this, but this
um,
is just about um, minding your own business, just like
yes. I mean,
normal life.
when I became so chiropractors here in the US have a lot of business education in
Mm,
their educational model. And I was networking with a chiropractor down the hall. And I asked her, I'm like, okay, do you have any good business books you recommend? And she recommended a book to me called Profit First. If you haven't read it, Profit First is a great book to read. And honestly, like just the change in my business of paying my salary first instead of trying to funnel all my money back into the business made my business successful. And so I
mm,
think it's not about being greedy or charging more for your clients or this and that. It's about saying like, what do I need to do in order to sustain this as a lifestyle? What are the practices and systems I need to put in place in order to be successful and get clients in the door? I tell practitioners who are trying to come into ShinKyu all the time and are like, hey, I need to build my practice. I'm like, go out and talk to other practitioners, network,
mhm,
build a community with
mhm,
chiropractors and doctors and pediatricians and nurses and estheticians and all of these other practices, right? Like, find people who are real estate agents. Like, you need to talk to other people and tell them what you do so they can
mm,
recommend you. But like, I think that the lack of community even stems to that, where people are like, I don't want to tell people what I do. I just want to use
yeah.
social media. I'm
Yes, yes, very important. Very,
like,
thank you for talking about it.
yeah,
Yes.
I'm like social media for our business model is not a very effective model, in my
Mm.
opinion. Like, it
But the
can
young
be.
people forget about this.
Yes. I'm like, you have to talk to, like, you go to the bank, you're getting money. When people ask you,
Mm,
how is your day? Say, it's great. I just treated a client for neck pain and it went away. Like, you shake
mm,
someone's hand, an old lady at the grocery store that you pick an apple for. How are you doing? I'm great. Today I just treated
yeah.
someone for back pain. I'm an acupuncturist. Like, you have to.
Yes,
interject your job into every facet of your life. People need to know about you,
yes.
you know? Anyway, it's an old
But
school method.
this, yes, yes, but this follows good quality first, good quality of education of your skills, and then after this we can talk about money, about building society and all those.
Mhm.
But the level of education of your skills have to be high enough that you are not shy to go out to people and tell that you are acupuncturist. I know
One00%.
quite a lot of people who are ashamed of being acupuncturists. They don't
Yep.
want to tell to other people that they are doing this
Yep.
because this is not really an occupation. In Poland, medical education, acupuncture is like something like esoteric or magic, or should it be treated seriously? Can't
Yep.
you get any real job like this? So first of all, I think we have to set good standards, good practical skills. Like as you said, you can really tell that you helped for neck pain, low back pain,
Yep.
all those stuff that people really feel every day.
Yeah.
So this is how it should be built.
Yeah. I mean, I think what
Mm.
you're saying is 100% accurate. It's honestly a lot of the reasons why people come to me in ShinKyu University to learn is because they don't feel confident about
Mm.
their approach to the body. They don't feel confident in the results. They are like, well, I don't understand why I got results one day and didn't get results the other day, and what's different, what's wrong, and it comes down to this lack of education, lack of mentorship, which is why I'm so glad when I found you doing this in Poland. I was like, yes, we have someone to teach people in Poland. Not that Poland is, I don't know, unique. We need someone in every country to be
Yeah.
able to teach. God, I wish we could have someone in India and Africa and all the different
Mm.
African countries. There's so many people who want to learn there. But it's really, really important. And unless you feel confident in your skills and in your results, you're not going to want to talk about things. And I think too that, that last little point that you brought up too, like my teachers told me in school, I was talking with them a practitioner who just I got her into school here and or helped her get into school, and she was over at my house yesterday and we were just talking while our kids were playing for Thanksgiving, and I was like, look, she's like, should I specialize in something? And I'm like, you can specialize after you can successfully treat shoulder pain,
Yeah.
neck pain, back pain,
Yeah.
knee pain. If you can't do these four things, you're never going to succeed. Shoulder, neck, back, knee. You have to be able to
Yes.
get
Yes. Yes. Yes.
these things done. And then you can specialize in internal medicine or whatever you want to do,
Yeah.
you know? Anyway,
Fully agree. Yeah.
yeah, side note.
Exactly.
Anyway.
Okay, so knowing that your skills are quite wide and you can do all those bloodletting, shonishin, every other technique, among all of them, what are your favorite?
My favorites.
What
I'm
do
not
you specialize in?
yeah, like I'm not a favorites kind of gal. I love all the techniques because I'm kind of a nerd. Not kind of, I really am a nerd. But I really enjoy bloodletting. I think it's really fun.
Okay.
I'm also the kind of I was the teenager that enjoyed popping pimples. Like I was that human. So
Okay.
bloodletting, I think, is just really fun and it's so effective. And because it's so effective, I've actually tried to use it less in order to try to push my needle technique and my moxa technique to the next level. Um,
Mm-hmm.
I I love doing non-insertive techniques. Like I treat pediatrics in 50% of my practice. So I really love being gentle and superficial. And because of that, I'm really trying right now in my practice to become better at deeper needling, like really deep
Mm-hmm.
needling, and
Okay.
using bigger needles because that's something that always kind of was a little scary for me. And
Yeah.
so right now in my practice, I'm trying to say, yes, I love doing superficial, but I'm going to really work on deep needling and get to love that. Um,
Mm-hmm.
and I also really love moxa. Like I love moxa so much. I love fire. It's so amazing. Um,
Mm.
such a pyro. But because of that, I'm really trying to do less moxa and be more successful with needling. So I'm trying to be able to achieve what I can achieve with moxa with my needling, or achieve a deep needling with instead of shallow, and vice versa.
Mm.
But
That's great.
yeah,
So good to hear that. So many wonderful things, wonderful topics that you can really teach us in Poland,
I can
beginning
try.
from bloodletting and of course moxa, many topics. I think the closer we will get to the June seminar with you, the more specific we will be about the schedule. But
Yeah,
um, all those topics sounds really fantastic
yeah,
for me. I think all those participants will really appreciate.
yeah,
So I'm
yeah.
really happy to hear that.
Yeah, I think bloodletting probably is the one. I don't know how your education is in Poland. Do you guys allow bloodletting? Is that a thing?
Yeah, yes, but this really technique came more to the orthopedic acupuncture
Okay.
for dry needling section, and many physiotherapists nowadays apply
Really?
this. Yes,
Really?
yes.
Oh,
This
wow.
is, yeah, according to Polish law, it's not forbidden, it's not allowed, it's in a gray
Gray
zone.
zone.
So,
Yeah.
yeah, yeah.
It's gray zone in Japan too, as a fun fact. It's also gray zone there too. And in the US, mostly a gray zone. In California, it's not allowed for acupuncturists
Mm,
to do bloodletting, which is super interesting. Um, and it is super effective orthopedic stuff, but it can also be extremely effective for like rheumatoid arthritis
mm,
or people who have Raynaud's.
mm.
Um, yeah. I would say for orthopedics,
Yes,
though,
but
100%. No
it gives short-term good results. But in Poland right now, there is this case. We have some patients who were started by other therapists with the techniques of bloodletting or quick prescribed acupuncture points for just um, mm, and no other. Sorry, we just
No, it's
want to
okay.
put it in words. So um, people are quite damaged from being started and without being continually treated afterwards. You know, just bloodletting, quick
100%.
insertions, and then don't physiotherapists or other therapists don't know what to do next. So
Yes.
this is the part that we now
Yes.
experience.
Yes, 100%. And I would say here in the US as well, because we also have dry
Mm,
needling, unfortunately. Fun fact is that dry needling does not exist in Japan. Only an
mm,
acupuncturist or a medical doctor can do acupuncture. You have to be one of the two, and you have to be licensed. They're very strict on license. Um, so there's been cases that I've seen when I first moved back to the US, my next door neighbor, I was trying to help him with his gout a little bit. And I was like, look, I can help you every once in a while, but I don't want you to go get dry needling. If you get dry needling, I'm out. Because that's my like
mm,
my business stance, I guess you could say, is, and I have this even in my like paperwork that people fill out when they come in, is that if someone's gotten dry needling within 2 weeks of their appointment coming to see me, I refuse treatment for them because
okay.
I don't want because dry people who do dry needling do acupuncture. They're doing acupuncture, right? But they don't have any, they have very,
Basic
very
knowledge.
little, very little education, right? And so my neighbor ended up going to a chiropractor and getting dry needling. And he came over to me like early in the morning before I left for school, and his Achilles tendon had swollen to like a baseball on the back. And I was like, I'm out. I would drain that and go to your doctor and report them because they did something bad, but it's the unfortunate thing is that, well, I guess the fortunate thing is that acupuncture is a very effective medicine. It is
Mm,
really strong and it can be really aggressive. I think with bloodletting particularly, it is very aggressive. And if you
mm,
don't know what you're doing, you can really screw someone up. You
Yeah.
can puncture their lung, you can puncture their spine, you can sever nerves, you can make them pass out, go into seizures. Like there's a lot of things that we can prevent and therefore cause as well,
Mm.
right? And this lack of education that's happening with dry needling is so scary and really unfortunate for the patients because they're the
Mm.
ones who are getting the brunt of this, right? So yeah, I good luck. It's hard.
Yes, yes,
Yeah.
exactly. This is what I think because, like what my sensei told me about Ishizaka-ryu, which I studied,
Hmm.
is that Sotetsu Ishizaka was a shogun's physician.
Hmm.
Yeah, so he treated the, like the highest rank general in the whole country.
Hmm.
It was super efficient, and it wouldn't be allowed if it wasn't.
Yep.
So this is the right place for acupuncture, and this is what we need to explain to people, that acupuncture is serious medicine. It's
Yes.
really valuable.
Extremely valuable. And like, yeah, I've actually I'll tag this in the description below. I've actually interviewed another teacher of Ishizaku-ryu before who
Yeah,
practiced in the
Kubota
US.
sensei, I know.
Yeah, and he moved back to Japan now.
Yeah.
But he is still doing a few classes. So for those of you who are interested, I would look him up. But Ishizaku-ryu, Yoshimasu Todo, who is one of the practitioners that my group follows as well, was also um, one of the physicians for Ienari. I think Ienari shogun, or I'd have to look up which shogun. But like we traditionally were the doctors of kings, the doctors of emperors, the doctors of the main generals, like
Yeah.
our medicine putting our medicine below dry needling, which is how I understand it to be put right now in Poland, is such a disservice to the public and is really dangerous to the
Mm.
public, I would add as well. Like I regulation is a bummer, but I think that regulation should be necessary, that people should at least have the education that they get in the US, right? Which is,
Mm.
you know, yes, there's good and bads, and we've already talked about that, but you need to have some base education. Otherwise, you can really hurt someone, you know?
Yes.
So,
This is one point, and like you said before, before you go any further, you have to be able to treat back, neck, shoulders, knees, all
100%.
those, and to be ready to help in acute conditions. But
Yes.
what is this really strong side of acupuncture is prevention.
Uh-huh.
We are really strong in prevention, and East Western medicine don't know how to work in prevention. In Poland, this doesn't exist.
Yep.
So we can save people from serious conditions, from going to for surgery and all those things. And this is really something that we can show and talk about with the Western doctors,
Yeah.
because this is something that Western medicine don't know how to answer on this.
Well, I
So
mean,
we have prepared ready answers for this.
yeah, and like just to show how acupuncture has helped Western medicine, if we go into things like fertility treatment, right?
Yeah,
IVF, IUI, all of
yeah,
that. Um, I was in Fertility Accurate Acupuncture Clinic where I started out my career with Dr. Joe, is mostly a fertility clinic, mostly. They do also treat a huge swath of the expat community in Japan, but um, honestly, fertility treatment, at least when I was doing it 10 plus years ago, the fertility Western medical doctors told their clients, please go get acupuncture. And the reason why is that if you got acupuncture for 3 months before doing your IVF transfer, you had a 15% higher chance of getting pregnant with a live birth. And so and that's huge for IVF treatments because the numbers aren't great in IVF even today. And if we going to children, like treating children, I have a client who I treat who was diagnosed with pediatric rheumatoid arthritis. Diagnosed, she was about to get on a biologic, which is one of the harder drugs now that they have for RA.
Mm,
And after 3 months of treating her, 3 months, only 3 months of weekly treatments, she was dismissed from the
mm.
rheumatologist,
Yeah,
right? Well, she
yeah.
was dismissed a year later, but she didn't have to go anymore after 3 months. And a year later, after monitoring, they were like, you don't have to see us ever again. Like
Mm,
I, not I, but because of the medicine, I was able to help that child's body get through that illness and save her from a lifetime of pain.
mm. Yeah.
Not just like getting a cold, but like 8 years old to 80, or 90 years old worth of pain. That's
Yeah.
huge.
Mm.
It's huge. That's 70 plus years of effect
And
that our
results
medicine is.
are so good that this is beyond discussion. You don't discuss about this. Just see what are results, and it is like it is.
Hmm.
So, but the other issue that shows up here is that, for example, I have met with a situation where in the infirmity clinic, doctors were trained to needle exact points for fertility,
Hmm.
and it didn't work because doctors didn't know how to work with the point to activate it. So
Yeah.
again, this is the starting point for us, for practitioners of Japanese acupuncture, to introduce how important it is to know how to handle this. No.
Well, I mean, I think if we were to flip that and say, if we were trained how to do an embryo transfer, we're still not going to get the results that a doctor has spent a lifetime trying to get. You can't replicate that with a machine, right? Like our medicine is not machine medicine. And if you told any surgeon that a machine could do their job as well as they could, they would laugh at you because a doctor still needs to drive the machine because they need to understand the differentiations of the anatomy, how the skin has changed, how those organs, tissues have connected, all of that. And so, yeah, it's just to tell a doctor, oh, just do this, and it's not going to work.
However, however, I loved your interview with Jeffrey Dan, I guess,
Yeah.
who was talking about this, that in modern acupuncture, there is still a lot of space for updating the knowledge of anatomy, of location of
Yes. Yes.
internal organs and all of this. So
Yeah.
I think doors swing both ways, you know?
Yes. Yes. I don't think that means, how do I say this? One of the other pieces of education that is lacking for acupuncturists in the US, I can't comment on Poland because I don't know your system that well, but definitely in the US and Canada is a lack of hands-on anatomical understanding
Hmm.
and a lack of really in-depth understanding of the body and how that relates back to our acupuncture. They'll learn about anatomy, but they never connect it
Yeah.
to the acupuncture. I mean, it's the same with the meridians versus the points versus herbs or Zong Fu. Like you have Zong Fu theory, you have meridian theory, you have point theory, you have herbal theory, you have anatomy, but none of them are connected,
Hmm.
right? And like, so people are like, I treat the Zong Fu, and it's like, well, that's great, but what about the meridian that's showing all of the issues of the pernicious toxin or element, right, that invaded that Zong Fu and blah blah blah, and they're like, that's herbal theory, and I'm like, but it's the same thing.
Yeah.
Same thing.
Exactly.
So yeah, I agree with you 100%. I
Mm,
agree with Jeffrey too.
great.
Yeah.
So, going further, what, in your opinion, is next level, higher level for acupuncturist? After you learn points, after you learn meridians, all those basic theories, what, in your opinion, is next level?
The next level is learning how to actually feel the energetics of the points and feel
Hmm.
the energetics of what's physically happening in the body in your own hands, and then being able to translate that to your needle, right? Like
Mm.
we need to be able, my group in particular, Yashinamichi really stresses being able to feel for Jackie or pernicious element or a wind invasion, right? There's a lot of ways we talk about this. Being able to feel what we call hibiki, which is a
Yeah,
version of
yeah,
decha,
I know.
dachi, sorry. You know, like, and being able to feel when a point is active or live. Shudo Denmei often calls it a live, no, an active point. And I just translate it as a live point, but like when a point is actually excess or actually deficient, and then being able to actually feel when it changes when you needle. I think that's the
Yeah.
next level.
So this is, I understand it very, very, very nice, and fully agree with you. But this is a really problematic matter because if we take people who are sitting and learning from the books and from the slides and scripts, you know, and talk to them, the next level is for them to feel, and this it is not written anywhere. They have to experience it on themselves. So it's a little bit too abstract and very, very difficult.
Well, I mean, here's the thing. Let's say that you're a tailor, that you're learning to make a shirt, right? And you've read 3,000 books on the different shapes of shirts and how to sew different fabrics and what different fabrics feel like. But you've never touched linen versus cotton, right? Or t-shirt cotton, which is really stretchy, right? And then you go to sew t-shirt cotton or go to sew linen, and you're like, I don't understand why my machine is getting jammed up. Well, that's because being a tailor, being a plumber, being an electrician, being an acupuncturist, a massage therapist, these are jobs of the hands. These are jobs that live in our hands, not in our head. And you can be the best theoretical, you can have all the knowledge on how to sew a shirt. But unless you really know how to sew a shirt because you've done it a bajillion times and screwed up a million times and have your teacher told you a million times, no, with linen, you have to use this speed or this machine or this stitch. I'm not a tailor, so I don't really know all the things, but you know, like unless you've done that, you're not going to be a good tailor,
Yeah.
you know? And
Or
so
like cooking, the same.
yeah, cooking, 100% cooking is the same.
Yeah.
You know, and I think this is the biggest difference between herbalists and acupuncturists because
Mhm.
herbs are very much in your head, right? At least for TCM. For Japanese medicine, Kampo is very much based on hard diagnosis and all of that, but for TCM, it's in your head, right? And so you just keep it in your head. But acupuncture, you have to feel. Otherwise, you're not going to be good at the medicine. And I think this, you know, to bring in a little history, I think you also have to understand that TCM came from herbal theory in China, right? Acupuncture TCM did not come from physically placing the needles. It came from herbal theory that was distilled down and made into acupuncture, which is not, can help, can work, but is not as effective. Whereas Japanese
Yeah.
acupuncture was created and built upon the theory that came from China classically by blind practitioners. They could not see your tongue. They did not care what facial color you had because they could not see it. They had to feel. And so it became a medicine of the hands. And anybody who's anybody knows that a blind person is more adept at understanding shape and sensation than someone with eyes, right? And that's how we
Mm.
need to be with acupuncture too, you know? In my opinion, again, I'm egotistical, but in my opinion, I think that's a more powerful version of the medicine. So,
Yeah, definitely, definitely. We forget that acupuncture is a form of manual medicine.
yes, acupuncture is
Mhm.
manual. It
Mm.
is not. I mean, the theory is there to back your brain, back your hands up when you are tired, when you been, you know, watched too much TV the night before, maybe you stayed out late and
Mm.
went to a concert. Then the theory is there to help you out. But really, you should be able to treat without thinking.
Yeah.
Like my teacher, Yasuda Sensei, says it all the time, my master Yasuda Sensei, and I say it too, that you should be lazy, be a sloth. Like I go to work practicing is so amazing because I don't think about anything.
Mm. Yeah.
I'm just like my hand says, hey, treat there. And I go, okay. Like,
Yes,
okay.
yes, this is simple for me, but so difficult for people who never tried Japanese acupuncture. My teacher says the same. we were asking him what is he thinking about where he is
Nothing.
practicing, and he told us that he's trying not to think about anything in particular. So
Yeah.
brain
I
dead.
mean,
Whoa.
I mean, I think this really brings us full circle in the conversation back to Zen, right? Zen meditation.
Yeah.
In that, in Zen meditation, it's a very simplistic meditation where you literally only concentrate on your breath. That is all you're doing is concentrating on the breath. It's different than Vipassana or these other different meditation styles. It's just the breath. And one of my other teachers, Annie Ashnomichi, explained it to me. His name's Harada Sensei, but I said, well, what are you thinking about when you're needling? And he's like, oh, I'm thinking, oh, it's a beautiful day, and oh, look, a leaf just fell. How pretty. Oh, there's a bird, and oh, I feel something here. Okay. It's just like very in the moment.
Yeah.
And
Yeah.
then once that moment has passed, it's passed. It's gone,
Yeah.
you know?
On
So,
the other hand, it's important not to thinking about something else, being somewhere else,
oh, yes.
doing shopping list or something like this. You
Yes,
have to be, like you said, in the moment and be present,
exactly.
but
100%.
not really attached to anything. Yeah.
Yeah, and I think that when, going back to your comment about the education and having skills, right? Like you cannot achieve that unless you've had a lot of education in technique. If you need to train your hands so that they move automatically, not move with thinking, right? And I mean, riding a bicycle. Do you ever think when you get on a bicycle, oh, I have to shift my weight and I have to pedal a little bit. Oh gosh, I have to put you don't think about that. You just do it. When you drive a car, you just do it, right? You have to get to that point. So,
Sure. I think this is the perfect place where we can put a full stop.
yeah.
This is great. This was the great sentence to sum it up. I think so. For this moment, I think this was perfect introduction of you to our community in Poland. It was really pleasure to
Same.
have you here today, and so we can now talk a little more about future plans. We want to animate all you people who are watching us right now to participate in my arrival to Poland, to Warsaw in June 2026.
Mhm.
We will be working towards this. We are planning to perform two, maybe three sessions online webinars or stuff on specific subjects. We will talk about this in future, yes?
Mhm. Yeah, I think, and we already have some dates for those. So if what I'll do is we can put the webinars below this, and then I'll create we can have like a sign up link for those who would like to come on live if they want to ask questions. And so I can put those in the description box below um, here on YouTube. And then can you remind me what is the dates for the workshop in June? I know we were middle of June, right?
Yes, middle of June. As far as I remember, it was something like 16th to 22nd
Mm-hmm.
June.
Yeah, something like
Yeah,
that. Yeah.
Wednesday or Tuesday
Looking
to
it up.
Wednesday, something like this.
Yeah.
But seminar will take place on the weekend, like Friday, Saturday, and Sunday. Your stay will
Yeah.
be from the, yeah. So
Yeah.
this is what we are planning to do. More specific information will come up later because this is the first time we are introducing this to the wider public. So yeah.
Yeah, cool. Yeah, I mean, as far as I'm concerned, I think what you're doing, Oscar, in Poland, from what I've seen, I know we haven't met in person yet, and I'm super excited to meet you. Although I know I'm going to feel very, very small. I'm a very short human. I think I'm going to feel like your child or something.
I'm also not the average Poland, so people say, yeah, we are normal here.
Okay. Very tiny. But no, I'm every time I see, even though I don't speak Polish, every time I see your Instagram and all of your social media, one of the things that really strikes me, I'm a super judgy human. And so the first thing I notice about all of the things that you put out And what I'm really excited to meet you is your posture. You have really excellent posture when you're practicing. The things that you're putting forth to show to people has, you know, the right amount of strength and the right amount of presence and all of that stuff. So I'm really excited to come out to Poland and see how I can add to what you're already doing because I think you've created such an amazing base for people there to learn traditional Japanese medicine. And yeah, it's just, I'm really, really excited about that. And then on top of it, for those who are members of ShinKyu University that might be watching this, we're also going to have our first ever European workshop right after the workshop with Oskar. So I'm very excited about that because I have several people all around Europe that have not been able to come to Japan or Canada or the US with me. So yeah, I'm really, really excited to see how we as a community can continue to lift up everybody else's practice and make it better.
Exactly, exactly.
Very
You have
excited.
told, yeah, yeah. This is what I wanted to say. So thank you
Yeah.
very much.
Yeah, of course. I'm really excited about it. I've never been to Poland. Some of my family is traditionally from Poland. It's just going to be really cool to see. So,
Very nice.
yeah,
Okay, thank you very much.
of course.
Moi drodzy, to była pierwsza rozmowa z Mają, którą przeprowadziliśmy, nagrywając ją wcześniej. Następne nasze spotkania planujemy, żeby odbywały się już na żywo. Tematy spotkań będą podane z wyprzedzeniem, daty oczywiście też. Prosimy o jak najszerszą odpowiedź, co myślicie o tym filmiku, jakie są szanse na to, że weźmiecie udział. Dajcie nam swój feedback, dajcie nam swoje wrażenia. I no, będziemy na bieżąco starali się informować Was i cały czas rozkręcać temat japońskiej medycyny tradycyjnej w Polsce. Także za dzisiaj dziękuję i do zobaczenia następnym razem. Arigato.
Arigato. Thank you so much, everybody, for watching. Like I said, the webinars, future webinars, I'll put the links below here that we're going to be doing with Oskar. This one was pre-recorded, but the future ones might be live. I think we're still deciding on that. But all of the links for that will be below, so you can check those out. And if you're interested in checking ShinKyu University out, seeing what I do, there's a link for a chat so we can talk. And if you're interested in coming to the Poland workshop with Oskar, I'll also put a link for that in the description box as well. If you're in Poland and watching this and you don't know about his training yet, you should definitely participate in it. I really, really recommend what he does. Although I'm sure he just said that in Polish, but I don't speak Polish, so whatever.
Yes, exactly. This is what I said.
So there's that. Yeah, and thank you so much for watching.
Thank
Cool.
you.
Bye.
Bye.